Shivaya. I am Gayatri Sandeep from 9th A. Today, 24th of March, is celebrated as World Tuberculosis Day. On this special occasion, I invite our guest, Dr. Sushi Susanti, the former student of our school, to deliver a speech about Tuberculosis Day. She completed her MBBS from DMWIMS Wayanad and now she is working as a resident in internal medicine in Aster Medicity, Kochi. A very warm welcome to you, ma'am.
Good morning, everybody. Today, before beginning my video on tuberculosis, I would like to take this opportunity to thank Brahmachari Reena ma'am, who has also been my principal during AMRITA VIDYALAYAM schooling days. And I'm also remembering all my teachers, all my beloved teachers during the World Tuberculosis Day, and for giving me this opportunity to make this tiny video. First of all, I would like to begin with what is tuberculosis, the so-called TB. You say TB in short form for tuberculosis. So tuberculosis, it is essentially a bacterial infection which is caused by the Mycobacterium tuberculosis, which is a tiny bacteria, which is basically a rod-shaped bacteria with a thick cell wall and all those microbiological features, which is out of scope for your level at present. So it is estimated that about 2 billion of people worldwide are infected with tuberculosis. That means if you can get a tuberculosis, or I can get a tuberculosis, that means all of us must be infected with tuberculosis at some point of your life. But the thing is, like, not all of us suffer from the disease. Why? The reason being is our immune system, because your immunity is so strong that it can resist infections like tuberculosis. So what happens, like, when does a person actually suffer from a TB? So that happens when there is a breach in the immune system, as in case like when you get diseases like HIV/AIDS, or when you grow old. What happens is, like, your immune system gets compromised and you start suffering from diseases like tuberculosis. So like I said, the organism being Mycobacterium tuberculosis, you should know how you get the disease. The Mycobacterium tuberculosis, it enters your body through inhalational route. So whenever a person with TB coughs or sneezes near you, you are likely to get a disease. Like if a person coughs, so when a person suffering from tuberculosis coughs or sneezes sitting near you, you are likely to get a disease. What happens is, like, the organism, it is transmitted through the air. So when you inhale this air, the organism enters inside your airways. Initially in the upper respiratory tract, what happens is, like, you have the immune mechanisms which clears this organism off. Some of them escapes from these our innate immune mechanisms and gets inside your lower respiratory tract. Okay, so where it causes the infection, where it starts with the primary infection, which is called as primary TB, where you get mild flu-like symptoms like cough or maybe a low-grade fever, then cough with sputum, or maybe a sweating or something. So I explained you regarding primary tuberculosis, which is often self-limiting in a person with good immunity, like me or you. So what happens, like in an immunosuppressed condition, as in like a person who's elderly, or if he or she is suffering from a major illness like an HIV or something like that, what happens is, like, this TB which has been there hidden inside gets reactivated. It spreads to all parts of the lungs, producing cavities, and then it is called as bronchopneumonia. Then it spreads via blood to different parts of the body, producing disseminated miliary tuberculosis. Okay, so it can goes into your meninges, in your brain, causing meningitis. It can then enters into your lymph nodes, which are, like, the primary defense mechanism, things which are present everywhere throughout your body. So it can cause lymphadenitis, especially in your neck, causing a scrofula. It can goes into your spleen, your lung, as I said, it produces bronchopneumonia, your liver, causing liver abscess. It can get into your kidney, causing sterile pyuria. It can goes to your adrenal glands, causing Addison's disease. It can get into your vertebra, causing Pott's disease. So now, so by now you might have you might be knowing about how the disease occurs, at least the disease how it spreads. Okay, so so now what happens is, like, what are the symptoms? The patient with tuberculosis, what symptoms you will expect in a person. Usually what happens is like an evening rise of temperature. You'll get a fever more towards the evening, or you'll have so much of night sweats. You'll profusely sweat in the middle of the night when you're sleeping. Okay, sometimes you'll have a cough which produces with mild sputum, or sometimes blood in the sputum, or sometimes you'll have extreme weight loss. You'll be very fatigued, you will be very pale, anemic. So symptoms can be a spectrum. Okay. Now coming to the treatment of tuberculosis. So the treatment of tuberculosis, unlike you get treated for a mild fever, it's not like that. Okay, the treatment of tuberculosis, it lasts for 6 months with multiple drugs. Okay, you have to take 4 drugs. I mean, you have to start with 4 drugs, which is isoniazid, rifampicin, pyrazinamide, ethambutol. So the names are all big names, which you won't be understanding at present, but still. So remember that TB treatment is not something short, but it's treatment which lasts for about 6 months, where you are, where you are told like you've completed the course of treatment. So you have to take this medicines for 6 months, which include 2 months of intensive phase and 4 months of continuous phase. So the 2 months you have to take certain amount of medicines, and 4 months like a maintenance dose you have to take this medicine. So at the end of 6 months you are like, you are declared that you've finished the treatment course of 6 months. So I've talked about the treatment as well as the complications of tuberculosis. Now your scope of interest is like how you can avoid getting tuberculosis. So a patient with patient with tuberculosis is always a prime suspect for spreading the TB to others. So isolate the patient while while dealing with TB positive patients. You should always wear a mask. Okay, so like a COVID patient, you should also isolate a tuberculosis patients. So next thing is that you should identify the warning signs, like I mentioned earlier, the symptoms, the classical symptoms of evening rise of temperature, night sweats, you are becoming very fatigued, tired, you are losing weight, you are becoming anemic, that means you're becoming pale, you're having reduced appetite, you'll have persistent cough, persistent cough lasting for more than 2 weeks. Sometimes with sputum or not with sputum. Sometimes you get blood streaks in your coughed out sputum, are all warning signs. So if you're getting symptoms like this, you should definitely go and meet your physician. So far we have discussed about tuberculosis in a nutshell. So I would like to conclude this topic of discussion with a small piece of information regarding the BCG vaccine. So the BCG vaccine, you might have noticed a scar on your left upper part of the arm, which is because of the BCG vaccine. The scar is left on your upper part of the arm. So BCG vaccine is that vaccine which you take it at the time of birth. So many people have a misconception that once you get the BCG vaccine, it completely protects you from tuberculosis. No, it doesn't completely protect you from tuberculosis. It is just a misconception. BCG, once you get it, just helps you from not going into the complications of TB. So once you are vaccinated with BCG, it doesn't mean like you are safe or protected from tuberculosis. It just prevents the complications or you going into a disseminated TB once you're affected with tuberculosis.
Thank you, ma'am, for your valuable words. It meant a lot to us. Once again, thank you so much, ma'am.
Namah Shivaya. Good morning to all. I would like to introduce myself. My name is Anushka Prakash and I am from class 9th A. Today, I am here to deliver a speech on the World Tuberculosis Day. We observe March 24th as the World TB Day. TB is an infectious bacterial disease that commonly affects a person's lungs. It can also have an impact on other body parts too, including kidney, brain, and spine. This day is celebrated by organizing various campaigns and health awareness programs globally. TB is top of the most killer diseases worldwide. This day is celebrated with a new theme every year. The theme of 2022 is Invest to End TB, Save Lives. This simply conveys the urgent need to invest resources to ramp up the fight against TB and achieve the commitments to end TB made by global leaders. The aim of celebrating the World Tuberculosis Day is to aware people about this disease. Many hospitals are organizing free camps for people to check their health with respect to tuberculosis on this day. Thank you and have a wonderful day.